Every great journey begins with a single step. And at Jesse K. Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practice, our healthcare assistant students gain real-world skills in real healthcare settings, preparing them to serve, support, and make a difference from day one. Because at Jesse K. Hospital College of Health Sciences, we don't just teach healthcare, we empower excellence. Admissions are now open for our January and February intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. Jesse K. Hospital College of Health Sciences, empowering excellent healthcare.
At Jesse K. Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit Jesse K. Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. Jesse K. Hospital, you first.
A very good morning to you, our viewer. Thank you so very much for joining the Healthy You program powered by Faith Today TV. We are so much excited about today because this is the day the Lord has made. We are rejoicing and being glad in it. In that same spirit, last week we covered health for the body, health for the mind, and health for the soul. So this is Healthy You program where you stay tuned and you keep on empowered in terms of health. Thank you so very much for joining. We are looking forward to an amazing conversation today. And I have been joined by an amazing team, experts who have delved matters TB. Today is World TB Day, and I'm looking forward to learn in depth matters TB, from prevention, from management, and all that. What are these things that bring, what are the causative agents of TB, and how is it prevalent in our community, and what can we do about it? Last week, Jesse K. Hospital, main sponsor for this particular program, had an amazing medical camp. We are passing our regards to them, and it was an amazing community outreach. We thank you for that. Even as we begin today, we are looking forward to heightening that conversation. So it's World TB Day. I don't know what that means to the viewer today, but to help us unpack ending TB, moving from awareness.
Just come and enlighten our community on health issue, and today specifically we are doing the TB, and today it's World TB Day. I coordinate health promotion activities within Lerionka Subcounty and Roysambu Subcounty, and Jesse K being in, it is one of our partners, one of the stakeholder, one of our facility in Roysambu Subcounty, and also extending to Lerionka Subcounty. We are excited to be here today and talk about TB. Thank you very much.
Good morning, Paul.
Good morning.
Say hi to our viewers.
Hello, viewers. I'm Paul Lerionka. I'm a clinical officer by profession. I serve this Nairobi County in health, specifically in Lerionka Subcounty, a facility called Babadogo. I'm a TB champion in our facility. And I'm also a clinician in Ruaraka MGT in service delivery, that is a primary care networking. Today, I'm pleased and I'm happy to join you in this awareness of coming to end this TB in our society.
Great. Maybe we can begin this conversation by just understanding the context of our world right now. What's happening globally? What's happening in Kenya in matters TB?
Well, thank you so much. Surprisingly, as we speak, there are people who are still dying because of TB.
Mm-hmm.
Despite all the support from the government, from the medical practitioners, from even the local, we have the CHPs. Despite all this support, we still have a challenge that today we can report a case of TB, that someone died because of TB. But why? That is the big question. Why are people still dying because of TB? If you try to see the statistics, that is from 2024 to 2025, based on the Ministry of Health. 2024, we have an approximation of people contracting TB being around 120 to 130,000 people every year. But the statistics as we stand tells us only 90 are being diagnosed and initiated on treatment. That tells you approximately another 20 to 30,000, 30 to 40,000 are missing and they have TB. That as I'm giving you the statistic of our beautiful Kenya. If you try to see the data of 2024 to 2025, we still have a number approximating to 15,000 people dying every year because of TB.
Wow.
Why? Let's come a bit low. In Nairobi, surprisingly, we are we are the leading in supporting that data. One, if I'll give you an data in Nairobi County, in every 7 patients who are diagnosed with TB, one is from Nairobi.
In Kenya?
In Kenya. And how many counties do we have?
47.
Yes, so you can now do the math. In Nairobi, we put all this in action.
Yeah.
To be sincere, we can't be running every year TB and people are still dying. It's an effort I will not put alone. It's an effort you will not put alone. So it's upon all of us to join hand in action. We only need now action because majority of people, they are aware of TB.
Amazing.
Yes.
We're not short of awareness. What we are short of is action.
Sure.
That 1 in 7 people in Nairobi County, 1 in 7 people who are diagnosed with TB, 1 is from Nairobi.
Sure.
For every 7 people you diagnose countrywide, 1 is from Nairobi. I hope Nairobians, you are hearing this. It's a big concern.
Sure.
That 30 to 40,000 people have this TB and they have yet not been diagnosed or treated at all. 30,000. So I might be walking to the next, might be walking or be accompanied by the next TB patient in that vehicle.
Sure.
Interesting. Are we making any progress so far? What is the county or sub-county doing in terms of just that burden? Because I want us now to transition to, there's somebody out there who's hearing about TB for the first time. They know now there's a burden, but what is this thing? When you talk about active TB, latent TB, what do we mean? So what is happening?
Thank you very much for that question. And I like the way you have picked the discussion. Why TB? And today, as we celebrate the World TB Day, maybe I can say the reason why we are celebrating the World TB Day, because many people are normally concerned about why should we celebrate the disease. And in way back 1882, there was a doctor called Robert who diagnosed the cause of TB. And he diagnosed the bacteria because TB is caused by a bacteria. And he diagnosed the treatment. The reason why we should embrace the treatment. Remember, it's 1882. And we are in 2026. And we are still talking about TB. So it is a major concern with our community, with everyone at large, because anyone can contract this TB. Because TB, the way it is spread is through the air. And we all breathe through this air. The reason why we should continue talking about TB, because if you don't breathe in, definitely one is going to die.
Yeah.
And the bacteria, it's in the air. The reason why we should continue talking about TB. And I like the statement that people are aware. The awareness is there. But are we taking the action? Are we taking the action? And coming to the question that you have asked, there are strategies which we have laid to make sure that we are eradicating this TB.
Yes.
All we are doing the prevention measures.
Yes.
In this way, we are talking about the prevention, we are talking about the management, because prevention is better than cure. So there are strategies, and we have started from the national to the county, to the sub-county, and to the community.
Wow.
So there are strategies which have already been put aside, and then roles and responsibilities distributed to various cadres so that we can act and know what do we do. In this case, I'm talking about the facility, their measures, all their strategies which have been put in the facility, their strategies which have been put in the contact management, and their strategies which have been put in outreach management. And when I talk outreach management, we come back to the congregation in churches, we go to the prisons, we go to the industries, we go to the schools, we go to the early child, the kindergartens, the schools in the community. Those are the strategies that we have laid apart. Remember the way this bacteria is passed. It's through the air. So we are all not safe. And that's why the 3 strategies have really been put in place so that we can talk about what is this latent TB, what is this active TB, and how can we manage and how can we curb this TB spread because of the cases that Dr. has talked about.
Profound.
Yeah.
You're emphasizing that the government has put in proper strategies from the national level, county level, sub-county level, and the awareness is not limited. Everybody right now has some sense of information concerning TB, but they're still ignorant. And ignorance is not defense. Maybe we're going to look at what are those issues. Then from contact tracing, outreach, we have had a lot of awareness. Now we want to get to action. Now maybe, Paul, you can help the viewer get to understand. There's somebody who has just heard about TB for this. I mean, we're assuming it's for the first time. The last time they heard the matatu was passing or something happened. So what exactly is TB and how is it transmitted? When you talk about it being transmitted in the air, what is passing in the air? So talk about that, and then a little bit signs and symptoms people should be keen about.
Sure. Thank you so much. Let me bring it clearly in a simpler way. TB is an infection.
Yes.
It's one of the chronic infection which mainly or majorly affects the lungs. It's caused by a bacteria, as my colleague brought it earlier clearly. This bacteria is transmitted through air.
Yes.
Through droplets that sometimes gets out of us through the mouth, through the nose, by sneezing, by talking, by laughing, all that. So that's how you can get your TB from inside your lungs out. And that is how it will meander now around this air. Assume today I have TB and the way we are talking. So that tells you all of us, we are not safe.
Yes,
we are not safe because we are sharing this air. In other words, the droplet of the bacteria which is now circulating here, you can inhale it. And because maybe in one way or another your immunity is not intact, you'll be a victim. And that's why, and actually the slogan now I usually tell people, no one is safe in TB. Because if you are not infected, you are affected in one way or another. Now that we've brought it that it's a respiratory or a lung infection, it doesn't mean it only affects the lungs. That is something it's good our viewers also to get it right. Yes, it mainly affects the lung, but it affects any part of the body. except around 3. 1 is your hair, 2 nail, and the teeth. Reason being, we don't have, they are not living, we don't have, they are not having living tissues. There is no blood circulation there. So there's no way this bacteria will survive there. Another thing to get it right is, this bacteria likes a place where it's well vascularized, where there's enough blood circulation. It needs also a good place to actually feed on you well. So that's why it can affect your lungs, it can affect your kidney, it will affect your skin, your brain, your spine, name them. There are things our viewers should get also right. One, there are some of the things if you see, if you hear, even not only you, your friend, your neighbor, all of us. One of the signs and symptoms is there are people who develop a cough. Yeah, this cough can be productive. It can also be dry. It can manifest with blood stain in it. There are people who can lose weight. There are people who can have some fevers. There are people who have unintentional weight loss. Don't tell me, maybe daktari, I've lost weight, but nimekuwa nikienda gym. This is not something you plan. Yes. So surprisingly, you just lost weight. You are also wondering. I mean, today you are wearing your trouser or your skirt. You are like, wait. The other day this dress was intact. Then what's happening? I mean, so in children also, those are still the symptoms. But in children, we can go to the other side where we see a child. You seeing your child is 1 year, but what's happening? My child is not growing. The weight is not coming up. My child is just restless. He can't do the normal activity like any other kid. What's not happening? I mean, those are basic signs and symptoms you will see. The other, which we also elicit or we get in most of the patients, there's also the issue of chest pain. There's the issue of difficulty in breathing. But the main one, you'll find weight loss, cough,
Persistent cough.
fever. We also have that fatigue, and we also have the drenching night sweat. Actually, mark it right. Drenching night sweat. As we speak, we used to tell our patients, any persistent cough, be screened for TB. But we are going slightly away from that. Any cough of any duration, the first thing, be screened TB. Because if today we'll wait for the cough to be chronic, I'm telling you, you could have actually spread that TB to many people. So today, if you get any sign, be it weight loss, be it a cough, be it a night drenching night sweat, kindly, we are open in our facilities. Just walk in, talk to your doctor. What's happening with me? It doesn't mean that it is TB. No, we also have other conditions. Yes, we also have other conditions which actually resemble it. But we will actually come to a closure of this. Just have a conversation with a professional. And that's why our facilities nowadays are being supplied with enough diagnostic equipment, starting from the X-ray, the gene expert. We are also doing microscopy, all that, so that at least we don't miss. But how can we miss if you can't walk in? Yes, sure.
So if you can't walk in, how will you be diagnosed? You've been staying at home and still complaining about it. Too much complaint, few or no action. So you've got to go to the hospital, go check. Maybe, there's this is it hypothesis that everybody has TB. The variation varies, whether it's active or latent according to the immunity. You can talk about a little bit about that, because there are those that those signs come, then they disappear. So maybe just decode that for them.
Okay. So thank you. Today, I want to bring it clearly. An active TB and a latent TB.
Yes.
All of them are TB.
Yes.
And surprisingly, all of them are being treated. Yes. So one, today, if by any chance I contract TB and my immunity is intact, I don't have any immunity issue. When the bacteria dislodges in my lungs, my immunity definitely will come in. Who is this? What are you doing here? You are an enemy. We have to tackle you by all means. So they make sure they suppress it. They don't give a room for it to multiply by any chance. So in other words, it will just, tunasemanga, imelala, TB imelala.
Lakini iko.
Iko.
Yes.
Imelala tu inaongoja an opportunity. When the defense is compromised, they come up.
Yes,
so that is the first thing. But the active one is now, for the latent, you don't have any symptom. There's nothing shows that you have a latent TB. You're just okay. You don't cough, you don't lose weight, you don't have any drenching night sweats. You're just perfect. But today, assume by chance you develop diabetes. By chance you have cancer. By chance your nutritional status is compromised. Wow, there we go. The TB comes up now. Then it becomes now active. The active now, this is where now the symptoms flare up. The cough, weight loss, all that. And have in mind, it's not a must for you to develop all of them. No, you cannot just only have a cough, but you are still, yes, you are not losing that weight. But with time, you'll also notice your weight is going down. Yeah. And that's why we don't assume even a single sign or symptom. Yes.
So don't assume any sign or symptom. Once you see one, rush to the hospital.
Exactly.
And you're not rushing to the hospital because you're afraid.
Yes.
It's because the earlier you diagnose it, the earlier it is to treat.
Sure.
Maybe, Jane, you can help us. There are people out there, they're saying, maybe I'm healthy, I eat balanced diet, I go to the gym, I'm fit. Who are these people who are mostly at risk of contracting TB?
Okay. Thank you very much for that question. And before I come to the risk factors, I also want to add what Dr. had said about the signs and symptoms. There are signs that Dr. has talked about that are affecting the adults, okay? And there are signs which are affecting the children. And there is something that we normally call the BMI, the body mass index. When the doctor takes the BMI, if it is less than 18.5, and because I know community leads a lot, that one is also a sign. And for this child, maybe how will this mother detect or get to know that this child is not okay? We talk about the child playing. The child is supposed to play, but you realize that this child is not playing. This child is not breastfeeding. If the child is breastfeeding, it's not able to breastfeed. This child is not eating. Okay? And this child is having something we call lethargy. The child is just there. So that's also a worry, beside of what the doctor has said. Then, when we come to the risk factors, we have said that everyone can be affected. Yeah. And when we talk everyone, even where we are at the studio, because of what Dr. has explained about the bacteria circulation in an enclosed environment. So looking at our community, the economic factors, where are we staying? Okay? Look at when we talk about economic factors, I'm talking about the structures, where we are living. Are we having aeration? In the churches, are we having aeration? In our houses, are we having aeration? Look at the population in our country. Okay? That's an issue, because if we are overpopulated in a place and there are 2 or 3 or even 1 person who is having this TB bacteria, will all be affected. Yeah. So the population part of it is also a risk factor. Okay? Another risk factor is the chronic diseases. Those people who the immunity has been, we normally talk about the immunosuppression or immunocompromised. So the immunity of this person has been compromised because there is a disease in me. I'm on treatment. The reason why we talk about feeding well. And in this case, we talk about good nutrition. We don't even tell this person about balanced diet. There is an engagement that we normally talk with this person so that we can know what food are there. And then we advise accordingly to the food which are available according to this person. And then we advise accordingly. mix this, take this, good nutrition. So chronic diseases, or if a person is immunocompromised, that's a risk factor. If a child has not been vaccinated, immediately when the child is born, there is a vaccine that we normally given against TB. That is BCG. And our community should understand the importance and the benefits of this vaccine. A must, that this child, when she is born, she must be given a vaccine. And the reason why the mother should give birth in a facility, and a facility that has skilled health care workers. And we don't encourage the community to go to a facility which is he or she doesn't know whether the people are qualified. And how can you know that? In our sub-county, all in where we are working, we make sure that there is that public-private partnership. So we make sure that the healthcare workers who are treating the community, they are qualified, they have the skills, they have the knowledge, what we call capacity building. So those are some of the risk factors that one can get this disease. And I repeat again, immunocompromised, the nutrition status, or any other disease that it's affecting you, all even not adhering to the measures which have been put across, like having a place which is airy, the air circulation, it's okay, all eating well, as I've said about nutrition, all infection prevention measures, so that we can reduce the risk.
Wonderful that there are risk factors, and these risk factors, from how you're hearing from Madam Jane, they are around you. It is you to open your eyes, not just wider. Some of us need goggles to see clearly, because awareness is all over the place. Because if it comes to nutrition, it's been emphasized from all, to lower levels of school, even as you go on with life. It comes to aeration, the people who are living in congested areas, and it's a risk problem. So we are running into a short break. Please prepare your questions. We will look forward with these experts to answer them one by one. So this program is still Healthy You program, and today we are covering TB awareness, and not just awareness, the action points you need to take as a community. As we celebrate this World TB Day, we hope you're going to take the action and not just save yourself, save your family, save your siblings, save the community around, and you have a role to play. Should you be a church, should you be a hospital, should you be a group, you have a role to play. In the second segment, we'll be looking at the prevention strategies, drug adherence, drug resistance, and what is happening in that pattern. So keep sending in your questions. We are looking forward to answer them. We're looking forward to hear what your experience has been in as far as interacting with the community and all that. Thank you so very much. See you in a few.
Every great journey begins with a single step. And at Jesse K. Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, Learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practice, our healthcare assistant students gain real-world skills in real healthcare settings, preparing them to serve, support, and make a difference from day one. Because at Jessie K Hospital College of Health Sciences, we don't just teach healthcare, we empower excellence. Admissions are now open for our January and February intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. Jessie K Hospital College of Health Sciences, empowering excellent healthcare.
Thank you very much, our viewer. That was an amazing first segment. You guys have really decoded this information and you've empowered us as a people. So thank you so very much. Those that are sending in their questions, thank you for the mentions. Thank you for those that have continually supported us. I am passing my special regards to Jessie K Hospital for sponsoring this program. Imagine without them, we could not be having such a program where we're empowering the community on matters, prevention and the health of their families and even themselves. So it's important that you keep checking your health. They are currently in Roysambu, Mariaine, and even Juja Farm, and they're doing an amazing job in partnership with the government. Amen. Great. So in this second segment, we're going to be looking at the prevention strategies. We're going to be looking at what are the existing gaps, then drug resistance. So let's begin it here. What are the existing misconceptions you have in the community currently that are still existing, even though the awareness is there? What are some of these misconceptions you've observed as you come in touch with these people that you feel they need to decode and they need to do away with? Maybe Jane?
Yes. Thank you very much for that question. About the rumors, the cultural beliefs that are there existing, the misconception, the misinformation that our community have. One of them, the community thinks, or as people think that TB is not curable. Mm-hmm. That if you have TB, you will not be cured. Mm-hmm. That's a lie. That's a complete lie. Because as I started, Dr. Roberts in 1882 discovered about this virus and the treatment was discovered. So we've been treating people and they have been cured. Next time, maybe when we'll be coming with the success story of people who have taken treatment according to what Daktari will tell us, the regime and the timings, and they have been cured. So TB is curable. That is one of the misinformation or misconception that the people have. Another misconception or a rumor is that that it's a belief that maybe it's a curse, mm-hmm. that this person has been cursed. Remember the signs and symptoms from this person, the emaciation part of it, being losing weight, mm-hmm. You are even having that stigma, such that even psychologically this person has been stressed. Emotionally, this person has been stressed. Physically, this person is not eating. So what will not think, people think that this person has been cursed. And then due to stigma, this person decides to stay indoors because she thinks that my family has been cursed. Why the family is because this virus it can be transmitted. If I have TB in my family setup, I can transmit to my child, I can transmit to my partner, I can transmit to the family which is coming to see me, I can transmit to the community which is near me. So some people think that it is a curse, so I'll tend to stay indoor. And then about the stigma of the treatment, people don't want even to be seen. that I'm taking treatment. That's a stigma of a kind. So you'll tend to hide the drugs while knowing very well that those drugs are the ones helping you. These drugs are the ones treating you. When you hide them, then the treatment will not be effective. There won't be effective treatment because you don't want to be seen swallowing the drug. Even the timings, they are not okay. Because if the doctor gives you the drugs and tell you be swallowing this drug at this time, now if you are somewhere, maybe you are in a church setting or you are in a service and you didn't swallow that drug, that's a misinformation because you are also fearing. Fear is also another kind of misinformation, misconception, because you are fearing, leading to stigma, leading to now what you'll be talking about, the drug adherence. So those are some of the rumors and the beliefs that misinformation, misconception we have been given by the community, or even when we hear when this client come, when this patient come to the to see doctor, even some they don't even say that they are coughing. Some they don't even say that my cough has blood stain. You know, because of that fear, what will doctor say? What will people say? But the healthcare workers are there to help. So that's another problem. You don't want to say where you are suffering from. Maybe you think it's another condition, and yet there are measures, as we said, that they have been put across to make sure that we detect early. In fact, we talk about early detection and for early treatment. Yes.
Profound. That to you, our viewer, TB is not a curse. To our viewer, the fear you are seeing around in the community is not even real. That the earlier you detect it, the earlier you receive treatment.
Sure.
And the earlier you receive treatment, the earlier you eradicate it from your body. And also that once you see any symptom, communicate it to your doctor early. Don't be afraid. Stop self-treatment. Maybe we can take this conversation a little bit higher. There's this resurgence of antimicrobial resistance. We won't touch much about that because it's a big problem currently. Let's now go and look at drug resistance in terms of TB. So what does that mean, and what are those levels? Okay. Talk about MDR in a minute.
Okay.
Yeah.
Thank you so much. Let me also bring something on top of what my colleague has really shared. And let me at least enlighten my viewers today. And I don't know why are still people associating TB with HIV. That today, if you have TB, they also associate that you are also HIV positive. For sure. Who say this? Where are we getting this information? And this is where the problem is coming out clearly. Because today someone is diagnosed with TB, he or she fears even to disclose to their family. And that is where we fail in contact tracing, getting those people who are in contact with this positive confirmed bacteria person, so that we don't transmit. Reason being, he or she fears, I'm diagnosed with TB, definitely, and automatically I'm HIV positive. It's a lie. Let me now come to on TB types. We have drug sensitive TB, when you also have drug resistant TB. So before even we go to the drug resistant TB, we have the drug sensitive TB, whereby the medication prescribed to treat this TB will clear it. And actually, what we usually do as a follow-up to our TB patient is, the first 2 months, we expect our medication to do justice to your TB tubercle in your body by clearing it by 2 months. And that's why if today we do a sputum, we've taken your sputum to lab, we've confirmed your bacteriologically confirmed TB. After 2 months of medication, we retest again. We take your sputum, go analyze it, and we get the report. And we expect it to be at 0. We don't expect any bacteria to be picked. It doesn't mean now you are out of TB. You need also another course of 4 months for you to clear the medication. That tells you how sensitive those drugs are to TB. And that's why we usually tell people, 1, TB drugs they are not harmful. They are actually helpful to your health. 2, it doesn't have any relation to what people believe outside there. People will tell you today, if you take medication of TB, you will never give birth. If you take TB medication, your lungs will be destroyed. Sincerely, we are here to secure and keep your lungs intact. Assume today, by chance, you've taken your medication and by 2 months, you said, Doctor, I'm okay. Let me just drop this medication. Or because I'm not near you, every day you take your medication, you start skipping it. This is how drug resistance comes in. Whereby, 1, you are misusing your drugs. Whereby you've been given a prescribed dose on how to take medication. Timing is very important. There's no room for skipping. There's no room for you to forget. I mean, some patient tells me, Doctor, what about if I forget? Who told you you'll forget in the first place? Is you are giving yourself a weakness that by chance I will forget. There's no room like that. How do you forget today that there's a meal I have to take? This is your meal for the next 6 months so that it will get out this TB. So drug resistance comes in, 1, if on the 1 is actually if today I'm diagnosed with drug resistant TB, I'm in a position to transmit drug resistant TB. Yes, that is the first thing. 2, today, due to other factors, 1, due to antimicrobial misuse, there are people who are really misusing these drugs outside there. Remember, previously, before, nowadays, it's very rare for you to get rifampicin being prescribed over the counter. Previously, they used to treat it with brucellosis. So imagine it's one of the TB drug you are using to treat another condition. So if today you get TB, your body will be used to the previous drug you've been misusing in between. So it will not really be in a position to do its work perfectly. Remember, this is one of the stubborn bacteria. If you try to see, it's a combination of drug we are using to hit it hard to make sure it doesn't multiply, it doesn't grow. By chance, it's dead by all means. So that's how one of the ways we develop with a drug-resistant TB. Today, how many of our patients, and in my facility, we have for now 2 patients of drug-resistant TB. One of them actually has been misusing drugs. Today, if we give him medication, he picks very well for the first 1-2 months. All of a sudden, I don't know what happens. If he sees his weight gain, no cough, everything is okay, he goes back to drinking, he goes back to smoking. And to make it worse, he disappears. He switches off his phone. There is no way we can trace him. You can imagine. So we contact the nearby neighbors, just in case you see him, please notify us. We also contact even the farthest place where he grew up, to his parent. We make sure, in case you see him, kindly do us justice. Either report to a nearby facility so that he can be helped. This guy coming back, we restart again our medication. He disappears after 2 months. I mean, after 1 month you come, and if it's past 1 month, we restart again. So tell us, where are we heading with this case? The next thing is we will develop a drug resistant, which will be even cumbersome to you. It is one of the drugs which you will not take it easily because of your health status also. Yes.
Maybe why do many patients fail to adhere to drug to that pattern, to that regimen? You know, there are those who will give complaints of their work. There are those, they are also afraid of carrying them there. What can they do to make their journey of drug administration easy, so that I know there are procedures, strategies you put in place. What are some of the things they can do?
Okay, thank you so much. The first thing is, once you are confirmed you are TB positive, the best you can do to yourself is accept the diagnosis. That is the first place we should do. Because today, if you will not accept that I am diagnosed with TB, for sure we are not going anywhere. It will be a rough road we are having in your treatment. So after, and let me tell you, there's a day I got a patient who told me, Doctor, I was diagnosed with TB in a certain facility. They told me I should start on treatment. I gave an excuse. Reason of the excuse, I feel I am not TB positive. And actually, we took your sample to the lab and confirmed you are TB positive. So what is making you not to believe? And it's actually, I'm not just saying it because I've seen you, you've lost weight. No, I have to have a tangible evidence through taking your sample or to the lab and having that today, this is your result. And we will see together that this is, for example, this is your X-ray. This is the nature of your lungs. This is how damaged your lungs are. So the reason we are starting treatment is because of this. So the first thing, let our patients accept that once you are diagnosed with TB, it's a very important time to accept it and start your treatment. Two, let's also accept that discrimination should not, or stigma should not play a part in your treatment. Because today, I have a challenge, most of my patients, they tell me, Doctor, you are telling me I should take this medication after meal. That is around, I usually take my meal at 8. So that's around 8:30 to 9. And that time, I'm at work. Where will I take the medication? My colleague will see me. So I'm just asking myself, if we are treating you, where does your colleague come in your treatment? It's your health status comes first. So you should not be stigmatized because of what people feel. As far as you need to take your medication, just excuse yourself. It's just like a minute. Just have a cup of water, go to your changing room, take your medication, and you're okay. If you fear people seeing you, take your medication. So that the next thing is very important. Have a good timing in your medication. Because once you accept, you know, I'm supposed to take at this time, that is another thing. Two, be also concerned about your family or whoever lives around you. That is another thing. Today, if we diagnose with you TB, you've started your treatment. Another thing is, that information should not end with you. Disseminate it to your children, to your wife, to your neighbor. That today we've been sharing a lot with you guys, but there's a team, because most of the time we use community health promoters to do what you call contact tracing. Yes, whereby if we get one single TB confirmed TB, actually we usually say we need at least 3 people out of that number. So one person should be equivalent to 3 contact traced person, so that we make sure that surrounding is cleared in the first place.
Sure.
But you'll find people, they fear disclosing this because they are like, whoa, how will they take me? They will never greet me. They will never associate with me. But what is the impact of you staying with your disease? And the others are having a positive case, maybe waiting a chance to come up, or even they are developing symptoms. Remember, if today we treat you, it doesn't mean you'll never get TB. If you expose yourself again, you'll still get it.
Interesting.
Yes.
Wonderful. The questions coming in, I think it's time we get to tackle some of them. And see, most of them have been answered through the responses we've done in this second segment. Somebody was asking here, what is drug-resistant TB? And how that, I think that has been cleared. If I've been vaccinated with BCG, can I still get TB? That's someone asking. If I've been vaccinated with BCG, can I still get TB? Then is TB test painful? You can maybe address that.
Okay.
Is TB test painful?
Okay.
And if the children were vaccinated with BCG, are they still going to contract that disease?
Okay, thank you so much. Let me bring it out on how we diagnose TB, so that at least people will have at least a straight, correct information. One, a TB diagnosis is not painful. That is the first thing. Let's get it right. One, because we only, for example, we only need a sputum. Kikozi too. When we get that kikozi, we just give you a small bottle, go to a specific marked area, have a cough. Just cough and put a sputum there. Take to the lab. We are done. Go home. We'll test. We'll make a call that your results are out. So come, we issue you your results. Be it if it's negative or positive, we'll issue you your results. That is the first thing. Two, for example, if it's an X-ray, there's no way you'll feel pain. That is another thing. The only thing I usually find parents or the guardian having an issue a little bit because of fear is for children. Sometimes because children, maybe 1 year or 2 years, they will not cough. Okay, they will cough, but they will not spit the sputum. So we have a challenge on collecting that. But here we come with a skilled professional. We use a NG tube, go into your stomach, aspirate the sputum. It's a procedure which is not painful. slightly it's a bit irritative, but there's nowhere you'll feel that much pain because we lubricate our tube, go in pole to our stomach while you are empty. Then we just aspirate whatever you'll find there. And that's why most of the time we usually tell parents, at least have your child not to have eaten something at least 3 hours. Then we go in, collect our sample nicely, and we get out safely. Nowhere actually will have that much pain. It's only that there's that fear that people, naingisha mtoto yangu, sure,
Wow.
it's true. Yes.
Maybe Jane, as you talk about the prevention strategies, you highlight some of the prevention strategies we have.
Yeah.
Somebody is asking, can I get TB from sharing cups and plates and spoons with someone? Mama Doni. Thank you so much, Mama Doni, for joining.
Thank you very much. I think also there was another question of the BCG.
Yes.
Whether someone, and BCG, I said it's normally given at birth.
Yes.
It's not given when you're an adult.
adult.
So we were all vaccinated when we were born. And for a test, we can test ourselves, which are here, that there is a scar on your left hand. That's where the scar is, to prove.
Yes.
Like Stanley has a scar, so it is a proof that you are given BCG. So that doesn't mean that you cannot contract TB. That is one of the prevention measures.
Yes.
It is one of the prevention measure. So if you live carelessly, like if you don't observe the measures, you can get TB. And now for the cup and the spoons, as Dr. said, when you start treatment, because now I'm double sure the person who has asked is asking on behalf of a person who is already having TB. And you are not supposed to separate those utensils because the person has already been put on treatment. And as Dr. said, the first 2 months, the person is supposed to adhere, strictly adherence to treatment. So the bacteria is already suppressed. So in this case, you are not supposed to separate the spoons and the
cups.
And the cups. But hygiene, it's very key. Hygiene, it's very key. Remember, that one can also cause stigma to the family members.
Sure.
To the family members, and we are trying to
separate.
protect the patient to be part of it, and talking to this patient, telling him or her that it is curable.
Yeah.
You can be cured. If we start the issue of separating, she'll be affected, he'll be affected psychologically, emotionally, physically, and that's not what we want. So we are not supposed to separate the utensils, but strictly on hygiene and adherence to treatment.
Maybe just a minute.
Yes.
I also support you in, by having one point. Let us get it also right. That today, if today I'll tell you, go and collect a sputum, and by chance you give me saliva, I'll give you a wrong results.
Yeah.
Because remember, let's get the science now. Where do we get our saliva? We have the salivary gland, which is not in our lungs. But where does this tuberculi actually try to inhibit itself inside our tissues? It's the lungs. So in other words, TB is not in your saliva. Yes. So today, if some people say, if I kiss, I have transmitted. If I mean, so it's good to get it right.
Yes.
Saliva doesn't have TB, but where TB comes in is from your lungs, but the sputum. Get it right, not the saliva. And that's why sometimes we are very keen on analysis of our sputum. If today you get your sputum, take to the lab, and the lab technician note that your sputum is not of quality. There's no need for you to proceed the tests. Just certify your patient. Even if you can't produce sputum by that time, you'll be given the sample bottle. Go with it home early in the morning. Make sure you have a sputum inside, not saliva.
Wow.
Yes.
I wish we had the whole day to record this, but in the spirit of limited time, competing for our unlimited ones, we have to stop there. That was an amazing conversation, and I'm sure somebody has been helped out there. Most of the questions have been answered, whether directly or indirectly, because people have asked about treatment. I hope, Anne, you've been answered. Thank you so much, Anne, for joining, and Ken as well. Most of the questions have been answered through the responses you made. I've learned quite a lot that it's curable and it's possible if only you're going to take that action. That saliva is not what is being diagnosed. I have to go to the sputum.
Yes.
If you don't get it, let me spend time until I get it. Because with proper diagnosis, there's proper treatment. Maybe we can give just in a minute a parting shot. Then how can people get to access you, or what do you want them to remember as we wrap up? I'll begin with you.
Thank you so much.
Yes.
At least our viewers today, at least even if not all information we got right, but you still have a chance of visiting us to our public facilities, even on those private facilities which we are now trying to incorporate them in the management of TB. One thing I want our viewers today to get it right. TB treatment is free. Let's get it right.
Yes.
There's no day today you'll visit your facility there, you'll be told for the treatment, it will cost you this amount of money. The government has really invested in making sure these drugs are available, and the diagnostic is also available. So it's only you to make an effort of coming to our facility. Not because you are sick. Today you can just make an effort that today I want to be screened. I just want to make sure I don't have any feature, or I'm TB free. So it's upon you to make an effort. Yes, we are also making an effort to coming nearly to where you are by doing outreaches, by having a close communication or contact or disseminating information with the community health promoters, just to make sure we don't miss anyone. But in case you feel by any chance we've not touched where you are, we are available.
Wonderful.
Yes.
Jen.
Thank you very much. My parting shot is my health first. And as I finish in a Kiswahili statement saying that tuwajibike sisi wote na tutibiwe na TB it's curable. Asanteni sana.
Profound. That was an amazing session. Thank you so very much, Jen and Paul, for decoding this and making it easy for us. I'm sure somebody out there has marked it right. And just a reminder, TB is curable. TB is preventable. As you prevent it, if you get it just in case, make sure that you get to seek treatment. And as well, early testing saves life. People die not because of that disease, because of the ignorance of not getting diagnosed. Because once you get treatment, there's a chance to your life. So it's not the end of life. Go and seek medication. Then completing treatment is very critical, because once you've known the problem, you begin to deal with the problem to the end. So complete your treatment as much. I know sometimes it's tedious, but make sure the discipline to get cured is what is pushing you forward. Then ending TB requires everybody's participation. All of us are in the business of ending it. The government, the private sector, the people, the families. If anybody gets this or contracts the disease in our families, we ought to support them and get to be their friends until they manage it. Even remind your parents in case they're going through, help them in the drug adherence and make sure they're doing that. Support them with the nutrition and all that. So thank you so very much for joining today. And this program is powered by Jesse K Hospital. Thank you for the continued support. Continue sharing this program to other people so that they can get this information. Continue sharing with your families, because awareness is available. Make sure you remind them to take action. See you on the next one. I'm looking forward to an amazing conversation. To this end, adios, muchachos. Thank you.
Thank you so much. Thank you.
That was a good one.
Thank you.
JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital. You first.